Tooth loosening in dogs. Deep periodontal pockets between the tooth and the jaw promote the development of bacteria and the tooth begins to loosen. These deep pockets present a particularly favorable environment for bacteria and in some cases, putrefaction bacteria which cannot tolerate oxygen, anaerobic bacteria, develop there. The disease can then worsen very quickly and many teeth may loosen due to the destruction of the jawbone around the tooth. Causes of loose teeth in dogs. Tartar can often cause dental loosening, called periodontitis. The bacteria invade dental plaque where food remains accumulate on the surface of the teeth. With the help of saliva, plaque calcifies and forms tartar. The surrounding gums are attacked by the bacteria and the dog shows inflammation of the gum tissue, i.e. gingivitis. At first, gum inflammation may be around one or more teeth, but gradually it can spread to larger parts of the oral cavity. Thick layers of tartar form on the teeth and the gums are red and bleed easily. Subsequently, the jaw is affected by inflammation, and the tooth decays. Symptoms of loose teeth in dogs. Many people research the cause of a dog's bad breath. The pet owner can see the tartar and sometimes realize that the dog is eating less well or not at all. Heaving can also be seen because the dog has difficulty chewing hard foods or bones and he bleeds easily from the gums when he eats. Just like in humans, toothache can affect mood and sometimes the master comes to consult because the dog behaves differently than usual. Which dogs are affected by periodontitis? Dogs of any age can suffer from periodontitis, although the disease is more common in older dogs. Some breeds are more susceptible to it than others, especially small ones. The Yorkshire Terrier, miniature Dachshund, Continental Toy Spaniel, miniature Schnauzer, miniature Poodle, Chihuahua and Cavalier King Charles Spaniel often suffer from tartar buildup and therefore periodontitis. Evolution of tooth loss in dogs. If the dog's tooth loss is advanced, some teeth will not be able to be preserved due to the condition of the jaw. In deep periodontal pockets, around one or more roots, bacteria take hold and the disease progresses. There is then a great risk that the dog suffers from toothache or that he has pain when he eats. At this stage of the disease, dental bleeding and fistulas are common. When the loosening is very advanced, the affected teeth are often pulled out. If the pockets are less deep, cleaning under anesthesia associated with preventive measures is normally sufficient to stop the disease. Sometimes the gums manage to attach to the tooth roots, but the destroyed jaw cannot be restored. It is therefore essential to seek treatment as soon as possible. Treatment of periodontitis in dogs. The tartar accumulated under the gum line is the greatest danger. This is where the bacteria responsible for tooth loss develop. Scraping with a curette on an awake dog is of little help in preventing disease progression. On the contrary, it can hide the reality if only the visible tartar is removed and the tartar under the gum line is left. To perform a professional teeth cleaning, the dog must be asleep. It is thus possible to pull out recently affected teeth and those that have been affected for a longer time. Even fractured or misplaced teeth causing problems to adjacent teeth can be extracted. It is not unusual for the veterinarian to pull out more teeth than estimated at the time of the exam, before the dog was anesthetized. The dog often does well, even with several missing teeth. In order to be able to follow the development of the disease and to be able to evaluate the result of the treatment and the follow-up, the periodontal pockets are measured around each tooth at the same time as the scaling. A dental diary makes it possible to follow the evolution of the disease. You have to understand the extent of the treatment the dog needs, and sometimes also plan it in stages. In case of periodontics, it is more suitable to carry out several interventions insofar as they are long, such as the extraction of several large teeth. X-ray. X-rays are a useful tool when treating periodontitis in dogs. One can see its development and more easily observe painful points such as abscesses at the level of the roots. X-rays allow early detection of diseases that dogs rarely suffer from, tooth resorption, and which destroy the tooth from the inside and form painful cavities. Prevention of dog periodontitis. Prevention is the best solution to avoid dental loosening. Even if some teeth are already affected, the disease can be prevented and stopped, and the other teeth will not be affected by periodontitis. Daily tooth brushing is a preventive method. Remember to regularly inspect your dog's mouth.